With much of the country slowly reopening and new directions from public health on where and when to wear a mask, your questions keep coming in. So joining me now to answer a few of those, ER physician Dr. Tasleem Nimji. Hello, Dr. Nimji, once again. Let's get right to the first question. Given today's recommendation by Dr. Tam, what kind of non-medical masks should people wear?
So I think what you're seeing is a lot of people wearing cloth masks, which is reasonable. And there's been conversations around the type of fabric to use, and you're looking for like a tightly woven cotton mask, for example. People are also using paper masks. And I think the key here is, again, these are non-medical grade masks either way. So we don't want people to be pulling away from the medical grade masks that are being used and required in hospital settings or healthcare settings. But these would be masks that you can either make at home or purchase.
Because are those blue paper kind of surgical masks, are those medical masks?
So the masks that we use in hospitals look very much like that. The ones that you might be buying, if they're not coming from a medical supplier, I can't speak to whether or not the filtration or the quality of the paper on the mask is the same. I don't know. I imagine that it might not be. So they look the same, but might not be exactly the same.
What about those masks with the valves or the respirators on the front? Are those recommended?
So I don't think, again, when we look at why these masks were recommended today, it was really around people that may be either just before they get symptoms, so we call that pre-symptomatic, or not have symptoms, called asymptomatic people, from stopping the spread to others. So it's about really limiting the respiratory droplets exiting your mouth to go past that distance if you can't maintain that 2-meter distance. Whereas when we use these masks in healthcare settings, it's really about keeping the healthcare workers safe as they are exposed to infectious particles coming from the patients that they're treating, right? So in the setting that's being described or recommended today, where we have individuals wearing the cloth masks to limit, and again, it's to decrease the amount of viral spread, then the cloth masks are sufficient, and you don't require the valves or the fancy sort of respirators on the side.
Okay, we've got time for one more quick question. If you wear a disposable mask, can you put it aside for a few days and consider it virus-free?
So you can put it aside for a few days. You just want to do that in a very careful way so that it's not going to contaminate surfaces or be something that other people might pick up inadvertently and then become contaminated themselves. Right. You want to be able to store it safely, but if you have stored it for a couple of days, coronavirus isn't very stable past that time period, so we can assume that the viral particles would be dead by then and it would be fine to reuse the mask. But if you're using a cloth mask, we do advise that you actually wash that mask.
Dr. Nimji, always good to have you on. Thanks so much.